Margaret was 68 years old and had always been known as the person everyone depended on when it came to memory. She could recall birthdays, anniversaries, family stories, and important dates without writing anything down. Every morning began with a crossword puzzle, and she rarely struggled to finish it. Her family often joked that she was more reliable than any search engine because she seemed to have an answer for everything. Then something changed. Over the course of about a year and a half, after a new prescription was added to her daily routine, small problems began to appear. At first, they seemed harmless. She forgot minor details, misplaced familiar items, and occasionally repeated herself. Soon those lapses became impossible to ignore. She struggled to remember what she had eaten earlier that day. Routes she had driven for decades suddenly felt unfamiliar. Conversations became repetitive because she could not remember what had already been discussed. Her family feared the worst. Specialists began considering the possibility of early dementia. The emotional toll was enormous because everyone assumed a progressive brain disease was taking away the woman they loved. But the real cause was something almost nobody had considered. The problem was not a disease hiding in her brain. It was a combination of medications quietly affecting her memory and cognitive function. With careful medical supervision, her medications were reviewed one by one. Adjustments were made thoughtfully and safely. Over the following months, remarkable improvements began to emerge. Her focus sharpened. Her memory improved. She returned to activities she had abandoned. This wasn't a miracle. It was a powerful reminder that some forms of cognitive decline may be preventable, and in certain cases, reversible. Here at Vital Aging, we're going to explore 9 common medications and medication patterns that may quietly interfere with memory, concentration, and mental clarity in older adults. The final item on this list may be the most important of all because it affects millions of seniors every day without their knowledge. Before we begin, remember that this information is meant to educate, not replace medical advice. Never stop a medication without speaking with your healthcare provider. Understanding what you're taking and how it affects your brain is one of the most important steps you can take toward protecting your long-term cognitive health. Before we move on to specific medications, there is an important principle to understand. The goal of this discussion is not to create fear about medications or encourage anyone to stop treatment on their own. Many of these drugs provide real benefits and in some situations can be life-changing. The issue is awareness. Every medication has potential side effects, and some of those side effects can affect the brain in ways that are often mistaken for normal aging. As we age, the brain becomes more sensitive to chemical changes. A medication that causes little difficulty in a younger adult may produce confusion, forgetfulness, slower thinking, or poor concentration in someone over 60. Unfortunately, these symptoms are Medication number 5 may surprise many people because it involves a group of drugs often praised for protecting heart health. These medications are known as statins, and they have helped countless individuals lower cholesterol levels and reduce the risk of heart attacks and strokes. For many patients, they remain an important part of a comprehensive treatment plan. However, there is another side of the conversation that deserves attention, especially when it comes to brain health. The brain is one of the most complex organs in the body, and cholesterol plays a more important role in its function than many people realize. Cholesterol is involved in building cell membranes, supporting communication between nerve cells, and maintaining the protective coverings that allow signals to travel efficiently throughout the nervous system. While excessive cholesterol in the bloodstream can contribute to cardiovascular disease, the relationship between cholesterol and brain function is far more nuanced. Some individuals taking statins report experiencing memory lapses, mental fogginess, difficulty concentrating, or a sense that their thinking is not as sharp as it once was. These experiences do not occur in everyone, but they have been reported often enough to attract the attention of researchers and regulatory agencies. One important factor is that not all statins behave the same way. Certain statins are more likely to enter brain tissue, while others remain more concentrated in the bloodstream. This distinction may help explain why some patients experience cognitive symptoms while others do not. Another consideration involves coenzyme Q10, commonly known as CoQ10. Statins can reduce levels of this naturally occurring compound, which plays a critical role in cellular energy production. Because brain cells require enormous amounts of energy to function properly, some experts believe this reduction may contribute to feelings of fatigue or mental sluggishness in certain individuals. The key message is balance. Cardiovascular protection remains extremely important, but cognitive symptoms should never be ignored. If memory problems, brain fog, or concentration difficulties develop after starting a statin, discussing those changes with a healthcare provider is essential. In some cases, adjustments to dosage, medication type, or overall treatment strategy may help maintain both heart health and mental sharpness. The objective is not choosing one over the other, but finding the safest and most effective path for preserving both. Medication number 4 is amitriptyline, a medication that has been around for decades and is still commonly prescribed today. What makes this drug particularly interesting is that many people taking it do not even realize it was originally developed as an antidepressant. Over the years, it has been used to treat a wide variety of conditions, including chronic nerve pain, migraine prevention, fibromyalgia, and sleep disturbances. Because amitriptyline is often prescribed in relatively low doses, many patients assume it carries very little risk.